welcome back. So in today's session, we're going to talk about something that's like pretty central to partial denture design, and that's direct retainers. And yeah, how they help us like get proper retention in a removable prosthesis. Now, when we talk about retention, we're basically referring to like the denture's ability to resist being dislodged, right? And that can happen from chewing, speaking, or even just sticky food pulling on it. Retention doesn't only come from clasps. There are also other factors like adhesion, cohesion, friction, and like even atmospheric pressure that all play a part. But the main thing, the one we usually focus on, is the mechanical part, and that's the clasp assembly. So mechanical retention mainly comes from like engaging undercuts, whether it's on teeth or tissue. And the more we can rely on those other factors I mentioned, the less aggressive we need to be with our clasp design. Now, when it comes to clasps, we usually divide them into two types, intracoronal and extracoronal. Intracoronal ones sit inside the crown of the tooth, and they're typically used when aesthetics are like a big concern, but they're kind of technique sensitive and have their own limitations. More commonly, we go with extracoronal clasps. They engage the external undercuts and like they're way easier to incorporate into most cases. Now, within that extracoronal group, we've got two directions a clasp can come from. So we have clasps that approach from above the height of contour. That's what we call a suprabulge. And then we have infrabulge clasps, which approach from below. And like the classic example of a direct retainer is a unit that includes a retentive arm, a reciprocal or bracing arm, a rest for support, and a minor connector. And together, they work to resist vertical movement and stabilize the prosthesis. So how does retention actually happen? Well, it's when the retentive clasp arm engages an undercut and deforms slightly when there's a dislodging force. The energy stored from that flexing is what helps keep the denture in place. But, and this is super important, only the flexible end of that arm, like the terminal third, should go into the undercut. The rest of the arm needs to stay above the height of contour. Otherwise, we might end up with like harmful forces on the abutment tooth. Now, for a direct retainer to really work properly, we're aiming for a few key things. It's got to provide support, resist lateral movement, and be passive when it's not under stress. Also, it needs to like encircle more than half the tooth's circumference. If it doesn't, it just won't lock in properly. And don't forget the reciprocal element. That's what balances the force when the flexible clasp arm like flexes over the tooth during insertion or removal. Whenever we can, try to choose clasps that naturally follow the tooth's existing contours. But like if small enamel modifications help improve retention or reduce stress, we shouldn't avoid them. Sometimes just a minor adjustment can make a huge difference biomechanically. And one last thing here, retention really depends on the depth of the undercut and how flexible that clasp arm is. Flexibility is influenced by a few things like the length and thickness of the arm, the shape of the cross section, and yeah, even the material we use. For example, wrought wire is more flexible than cast metal, and since it can be used in smaller diameters, it's often more forgiving, especially in like compromise situations. Now, when a denture is like fully supported by teeth on both sides, like in class 3 cases, there's very little rotation or tissue ward movement going on. So that means we don't really need like stress breaking clasp designs because the abutment teeth aren't under the same kind of forces we'd see in like distal extension cases. So in these situations, the main goal is just to retain the denture effectively without damaging the abutment. The classic go-to in these cases is the circumferential clasp, sometimes called the Akers clasp. It's like simple, super reliable, and pretty easy to fabricate. So the retentive arm curves from above the height of contour, like down into the undercut, and the reciprocal arm sits across from it to brace the tooth. Ideally, that bracing element shouldn't engage any undercut. It needs to stay rigid. This design gives us like really solid stability and doesn't trap as much food as infrabulge clasps. But yeah, it's not perfect. It's more visible. It covers more of the tooth, and it's harder to adjust because of like its half round profile. Now, there are times when you're dealing with teeth that are like tilted or positioned weirdly, like say molars leaning mesially or buccally. And in those cases, you might need something like a ring clasp. This clasp basically like wraps around almost the whole tooth to engage an undercut that's on the same side as the rest seat, which can be super useful when other options won't work. That said, it's not without its issues. It covers a lot of tooth surface, which makes hygiene tougher and it's like notoriously hard to adjust. Plus, the supporting strut is essential. Without it, the clasp can flex and like lose its reciprocal function. Another design we uh, come across is the embrasure clasp, also known as the double acres clasp. This one's used in spots where like there's no edentulous space, like between two adjacent teeth in a quadrant. You've got two rests, two retentive arms, and two bracing arms here. And because of all that, the interproximal surfaces like need to be modified to fit everything in. It's not usually the first thing we reach for, but it can be a total lifesaver in certain situations, especially when uh, no other clasp will work. Then there's the C clasp, sometimes called a hairpin or reverse action clasp. This one lets us use an undercut that's like right next to the occlusal rest. It sounds helpful, and in theory it is, but honestly, it's not that popular. It's hard to make, even harder to adjust, and it kind of traps food more than we'd like. And if the crown of the tooth is short, there's like just not enough room to create a flexible arm. So the whole point kind of um, falls apart. Generally speaking, cast Suprabulge clasps work like really well for most tooth-borne cases, but uh, there are definitely exceptions. If aesthetics are like a big concern, or if the abutment tooth is mobile or has a poor long-term outlook, we might go with a wrought wire clasp instead. Wrought wire is more flexible, which means it puts less stress on like compromised teeth. It can also engage deeper undercuts, giving us like a bit more freedom in where we place it. And it hides better, which is always a plus, especially when we're dealing with like anterior teeth. On the downside, some cast Suprabulge designs can create what's called the pump handle effect, especially in distal extension cases where the guiding plane isn't like short or relieved properly. Some clasps also just don't work well on tilted teeth. And honestly, a lot of the more complex designs end up like covering more tooth surface than necessary, which kind of compromises both hygiene and aesthetics. When we're dealing with like tooth and tissue supported removable partial dentures, so we're talking about Kennedy class 1 and 2 cases, the clasp selection becomes a little trickier. The main challenge is that these designs are like more prone to rotation during function. That's because the denture base doesn't rest fully on teeth. It sits partly on soft tissue, and that allows some vertical movement. So if we're not careful, this rotation can like place stress on the abutment teeth, especially the most posterior ones. That's why in these cases we tend to go for clasp assemblies that include some sort of stress breaking feature. So instead of a rigid circumferential clasp like we would in tooth-borne cases, we usually lean toward things like the RPI system, the RPA, or even like a combination clasp with a wrought wire retentive arm. These designs are more forgiving when the denture rotates under occlusal pressure. One of the most common and like most effective options is the bar clasp. It's a cast component that approaches the undercut from below, from the gingival direction, unlike the conventional Akers clasp that like swings in from above. You might see variations like the I bar, T bar, or Y bar, but the I bar tends to be the most conservative and like the least visible. It does a great job of engaging the undercut without wrapping around the tooth, and that makes it more aesthetic and like easier to keep clean. But there are limitations. You need enough vestibular depth, like at least 4 millimeters total, to accommodate the arm without impinging on the gingiva. And any soft tissue undercuts or prominent frena can make this design like difficult to use. Now let's shift our attention to the RPI clasp assembly, which is kind of the gold standard for distal extension bases. The name says it all: R for mesial rest, P for proximal plate, and I for the I-bar clasp. The idea here is to like distribute stress more gently on the abutment tooth and allow a bit of movement without creating torque. The rest in this setup is always placed mesially, usually on the mesio-occlusal surface of a premolar or like the mesiolingual aspect of a canine. Then the proximal plate slides along the distal guiding plane, and the I-bar comes up from the framework and like engages the buccal undercut just beneath the height of contour. One subtle but important point here is how reciprocation is achieved. On premolars, the rest, the proximal plate, and the minor connector all help stabilize the tooth as the eye bar flexes into place. But on canines, the rest sits like pretty low on the cingulum, and the minor connector doesn't engage early enough. So in those cases, the proximal plate alone serves as the reciprocal element. And finally, to make sure everything like tracks along the same path during insertion and removal, we rely on a well-prepared guiding plane on the distal surface of the abutment tooth. It's a flat, parallel surface around 2 to 3 millimeters high, and it plays a key role in keeping the prosthesis like stable and limiting unwanted tooth movement. So, like, there are a few situations where you can't really use an RPI clasp if the vestibule's like too shallow and you don't have that 4 millimeter clearance from the gingival margin. Then the eye bar just doesn't really have enough room to function properly. Same thing if there's no buccal or labial undercut to engage, or if you're like dealing with a severe soft tissue undercut, that would make bar clasp placement kind of traumatic. And finally, if the only available undercut is on the distabuccal, you might not be able to get that required 180-degree encirclement. So, yeah, the design just wouldn't be retentive enough. That's where the RPA clasp comes in. It's like almost identical to the RPI, but instead of using an eye bar, you've got this wrought wire circumferential clasp, usually engaging the mesiobuccal undercut. And that's like ideal when the eye bar isn't an option, but you still want that stress breaking design using a flexible wrought wire retentive arm. And so that kind of leads us right into the combination clasp. This one's sort of a hybrid, right? It uses a wrought wire retentive arm with a cast reciprocal arm. The round wire is like flexible and can engage deeper undercuts up to 0.02 inches, which means it can sit lower on the tooth, improving aesthetics. And because it's more adaptable than a cast arm, it's great when you want to adjust retention without like remaking the whole framework. But yeah, it's really important to handle it carefully during fabrication. If it's overheated during soldering, the wire can lose its flexibility. So we usually solder it away from the framework or use low fusing alloys. Now, there's always been a bit of debate around the distal rest concept. Like, the concern is that when you place a rest on the distal side of a tooth in a distal extension case, you kind of risk torquing the abutment during function. But if the design is done right with like a short guiding plane and a little relief between the connector and the tooth, the rest can actually disengage under load. That lets the prosthesis shift slightly without, putting too much force on the abutment. Still, like to really minimize torque, we try to place the retentive arm into a mid-buccal undercut and keep the clasp tip above the height of contour. That way, if the prosthesis moves, the clasp will just disengage instead of like digging in. Now, when we're selecting which direct retainer to use, there are a few big factors that come into play. First is the position of the undercut and whether there are like any existing restorations or occlusal interferences. Then we look at the soft tissue and bony architecture. So is there enough vestibular depth? Are there bony prominences or frena in the way? And of course, like aesthetics, especially in the anterior, can totally influence whether we go with a cast clasp, a bar clasp, or maybe even a wrought wire option. So to kind of simplify this, for tooth-borne cases like Kennedy, Class 3, and I4, the go-to is usually the cast circumferential clasp. It's strong, stable, and pretty predictable. And if there's like no usable undercut near the edentulous area, we might consider a double embrasure clasp. And if a tooth is tilted, we can adjust, maybe use a ring clasp or even a rotational path design. For distal extension cases, so Kennedy Class 1 and 2, we really want to protect those abutments from torque. The first choice is typically the RPI system, but if the vestibule is shallow or there's like a soft tissue undercut, we usually move to the RPA. And if the mesial rest isn't possible, like maybe there's a big restoration or a centric stop in the way, then we'll go with a combination clasp. At the end of the day, we want to make sure we're using like a minimum of 2 direct retainers for Class 1 and 2, and ideally 1 on each abutment in Class 3 and 4. But if aesthetics requires us to drop a clasp from a visible area, we can kind of make up for it by increasing retention somewhere else. like longer guide planes, more tissue coverage, that sort of thing. All right, that wraps up our discussion on direct retainers and clasp selection for both tooth-borne and tissue-borne removable partial dentures. I know like it's a lot to take in, but honestly, understanding these small design choices can make a huge difference in comfort, function, and longevity for your patients. If you found this helpful, don't forget to like the video, drop a comment if you've got any questions, and make sure you're subscribed so you don't miss the rest of the series. See you in the next one.